in if you have. You won't hear me saying that if that's happened. Beth, the floor's yours for the next 15 minutes. Thanks.
Okay, thanks, Colin. I appreciate that. I'm really delighted to be asked to contribute to this webinar. I think it's asking important questions about the challenges in justice social work, what can be done to improve services in the context of what some people are currently calling a penal crisis. And so my focus is on minding the gap, contextualising the Prisoner Early Release Scotland scheme. Now, for as long as I can remember, academics, policymakers, professionals, practitioners have been both lamenting and warning about the escalating prison population. They've been unpicking the various reasons that can explain it and proposing both ameliorative and radical solutions. And yet, here we are again. So I'm not sure this is actually about services. And I think that's my point of departure. So back in 2008, and that's 16 years ago, I'm just trying to prove I can count, Henry McLeish and his commission had the ambition to radically reduce their prison population. Not long after the publication of their report, on the 30th of September in 2008, the BBC reported that there was no extra space in Scottish prisons. SPS chiefs were warning that prisoners could be released from Scottish jails in an emergency situation because of overcrowding problems. Does this sound familiar to anyone else? So its capacity then was 6,625, but they were holding 8,056. I probably don't need to remind you, but I'm going to anyway. The McLeish report contained a very sharp analysis of why the Scottish prison population had risen rapidly in recent years before its population. And that included high imprisonment under low crime conditions, the imprisonment of those who are troubled rather than troubling, imprisoning people for very short periods, high rates of recall from license, and imperviousness of the prison population to crime trends. And all of this is very familiar in contemporary times. Now, their report contained 23 recommendations, and I think it covered an almost unprecedented range of criminal justice issues, but perhaps most remarkably, it called outright for a reduction target to be set for the prison population from nearly 8,000 to 5,000, and that was a drop of 35%. And of course, it was proposed that this would be achievable if the prison was reserved for those whose offences are so serious or those who pose such a risk of harm. And then with community-based services being the default for other people. Actually, when you look back, that idea was first proposed 35 years ago by Malcolm Rifkind in 1989. Anyway, what's happened since McLeish's report? So we built some new prisons and then we filled them. We legislated for a presumption against short sentences, first to 3 months, then to 12 months. That was around about 5 years ago. I agree, the number of short sentences are reducing, but current figures suggest that a stubbornly high 68% of the prison population are serving sentences of 6 months or less. As worryingly, current statistics also appear to be suggesting that sentences are getting longer. So the average custodial sentence in the time of McLeish's report was 263 days. 10 years later, it was 318 days. So that was a 21% increase. In 2022, it was 376 days, and that was 14% longer than the year before. So I think I don't need to explain that pattern to anybody, but this didn't include people who were convicted of murder or were serving OLR sentences. So the average time served for murder has also increased from 8 to 9 years in the early 70s to nearly 20 years today. 20 years ago, nearly 30% of lifers got parole. Today, 12% do. So we're quite conservative about our use of parole as well. So between March 2022 to March 2023, there were 1,714 people considered for parole in Scotland. Only 198 people got it. So that means only 11.5% of people get parole. Home detention restrictions, they have a large impact on the prison population. And of course, we saw a massive reduction in the use until recently. This year it has doubled, but for quite some period of time, we dropped from about, say, 300 to 50 on any given year. We have seen a concentration of bail supervision cases in this last year, and this reflects a renewed focus on bail supervision and the escalating remand rates. So we've got almost double the number. I think it was 1,100 when I checked, and that's the highest in the last 10 years, and that's good news. But I also checked, and we have 2,000 people, nearly, I think it's 1,886 people on remand at the moment, out of an average of 8,300 people in prison. This is not a meaningless figure. So, of course, this has prompted the Scottish Government, like the UK Government, to implement those early release measures to alleviate the pressure on prison services. But given the tone of this conversation, how radical is this proposal? Well, it only applies to short sentence prisoners nearing the end of their sentence, who will get out having served 40% of their sentence rather than 50%. And it excludes people convicted of domestic abuse or sex offences. My guess is that this short-term solution is not going to radically alter the prison population. We're looking at a 5% reduction, presuming those released do not get re-imprisoned. It only just brings us under the capacity threshold. Current figures suggest of the 477 people released, 57 were later returned to prison. So that's 1 in 10, obviously. So that will just take us just a wee bit below capacity. It's a far cry from McLeish's aspirations. And I can't help but think letting people out early is a bit cart and horse. If they don't pose a risk, such they can be released early, why are they even being sent to prison? So when I started preparing this, I noticed that the population figure in June, when the early release scheme commenced, was 8,232. 477 people were released, primarily to Glasgow, North Lanarkshire and Fife. And then last week, on the 25th of November, the prison population was sitting at 8,277. So it's still going up. So of this population, as I already pointed out, and I can't say it enough, 1,886 people untried. Why are they even in there? So what is the issue? Where are the different... Well, there are different bodies autonomously making decisions about punishment and justice, quite apart from the aspirations and intentions of policymakers, which is a recipe for a policy failure, or what we call a policy implementation gap. Whether it's a PF opposing bail and advocating remands, whether it's a sentencer deciding to jail someone rather than putting them on a community sentence, or whether it's prisons avoiding the use of home detention curfew, or whether it's parole boards preferring not to release or opting for recall for minor misdemeanors. What's going on here? Is this a crisis of confidence in community-based measures? And if so, what's the story underpinning that? Well, there has been a reduction in the use of CPO. We're still well below pre-pandemic levels. But I don't think this is a practice issue. This isn't about our services. Critically, our community services are grossly under-resourced, and this isn't just justice social work. It's mental health services, it's housing, and it's addictions. Justice social workers are dealing with increasingly complex caseloads, and yet still local authorities are being asked to cut services and resources and take on more. Are sentences and others then losing confidence in the capacity of services in justice, health, mental health, and addictions to adequately offer the support that's needed to effectively manage risk or address needs? And what effect then will the Prisoner Early Release Scotland scheme have? Scottish Government commissioned a Fairer Scotland duty impact assessment of the situation and the bill on the socio-economic disadvantage and inequality of outcomes on families and those imprisoned and those released. Unsurprisingly, I fear, they identified that housing is a major issue complicating this process. We know that precarity or lack of housing disproportionately affects those entering and leaving prison. There is again an unsurprising but established link between homelessness, offending, and imprisonment. The SPS 2019 survey noted that 56% of respondents lost their accommodation when they went to prison. Over a third didn't even know where they were going to be living when they got released. I mean, it's not uncommon in some cities for people to be released onto the streets with a sleeping bag. And this isn't just about shelter and safety, it's also about access to healthcare and benefits. And much more importantly, it's about human rights and social justice. We know what the solution is, and it probably isn't releasing people a few days or weeks earlier than we planned to. We need to invest in community justice. We need to invest in justice social work, health, healthcare related services. We need to stop remanding people as a precaution or as a punishment. We need to stop sending people to prison as a punishment because it's harmful, and it's harmful for individuals, for families, for services, and for the system. Yet limiting people's time in prison might offset some of the harms that prison gives rise to, but not by much, just by 10%. Because the challenges faced for people on release are exactly the same. Right now, the urgency isn't about what justice social workers and justice social work services do. It's about what PFs do. It's about what sentences do. It's about what parole boards and policymakers do. The problem with prison is a wicked one, which has withstood numerous well-intentioned but rather overly optimistic policy reforms. And this has resulted in a gap between the problem issue and the problem solution. I appreciate that, unlike these other players, I've been rather pessimistic about the potential of his latest initiative to address the issue of overflowing prisons. But it does yet again underline the need for urgent reform and meaningful reform. This input took as its departing point the landmark McLeish report, Scotland's Choice, whose comprehensive review of our justice system advocated critical recommendations for its reform that were both progressive and ambitious in equal measure. In so doing, this provided a lens through which to evaluate our progress in light of contemporary concerns. Our high rates of punishment challenge the idea of Scotland being a progressive, welfare-orientated, rights-respecting nation. We have the highest imprisonment rate in Western Europe and the fifth highest rate of people subject to community supervision across the whole of Europe. Our overconsumption of prison punishment is paradoxical for a nation which has been trying to reduce the use of prison for 120 years. In this, Fergus McNeill, as he said in his book on pervasive punishment, that stems from a mistaken assumption that diversifying and expanding alternatives to prison would reduce its use. What's happened is that this has happened at the same time as a growth in prison populations. And so what we see is a gross net widening effect. It's got as much to do with our collective failure to address broader social inequalities, with processes of criminalisation, and with reactionary populist penal policies which belie its stated progressive welfare aspirations. So for me, the need to make substantive progress is long-standing and increasingly urgent. And I think to respond to these issues, we need to come up with much more radical solutions than we have done so far, or we're going to find ourselves back here again before too long. And that's my wee rant over.
Beth, that was absolutely brilliant. Thanks so much. That was a fantastic overview of all the issues surrounding the way we use prison in society. And you've highlighted, as well as justice services being under-resourced, the chronic lack of capacity in mental health and housing services for people that end up in prison and leave prison. And you've pointed out, as we've known for a long time now, same with a lot of the things you said, we've known all this for a long time, that we do have the highest rate of imprisonment in Europe, which is just shocking. Scottish government, with this budget, I believe, are increasing funding of justice services to 148 million. I guess the question is that enough? And does it go anywhere near addressing the kind of issues that you've raised? So I'm going to shut up and I'm going to hand over to Jackie Hamilton, but I'll introduce Jackie. She's spoken at one of our sessions on justice services before alongside Fergus McNeill, who Beth mentioned just then. I've known Jackie for a long time. She's a loyal UNISON member. She's been out on the picket line when it's been necessary for us to take action. So I know her well from Ayrshire. She's been involved in justice services for a long time. And I can remember her in the court in Kilmarnock many years ago, doing her stuff there. So welcome, Jackie. Jackie is current now. I say currently, it sounds like she's about to be sacked, or maybe she will after she speaks today. But Jackie's a senior manager for justice and children, or children. Yeah, anyway, Jackie, yeah, senior manager for Children Justice Services in South Ayrshire. So Jackie, the floor's yours for 15 minutes or so. Thank you.
Thanks, Colin. Yes, it's been a long time back in Ayrshire, or I'm still in Ayrshire, sitting here in my room. Thanks for inviting me to come and speak about one of my favourite topics that I can wax lyrical on for a long time. Justice social work is definitely where my heart is. Although I know there's a couple of people on from Children's Services, so I have to say they've got a wee bit of it now as well. This is an absolutely huge topic, as both Beth and Colin have touched on. So I'm going to take you back a wee bit to, according to the Social Work Scotland Act 1968, each of the 32 local authorities in Scotland has a duty, a statutory duty, through their Chief Social Work Officer to provide services to offenders. Over the years, this was a bit of a postcode lottery, where child protection always took the pressure of any social work department. In 1991-92, Justice Social Work was introduced alongside national objectives and standards, which was an attempt to regulate practice at a national level. This included ring-fence funding, which ensured that services were delivered directly and timorously to the people who had committed offences. This involved mainly at that time probation, community service and writing the assessment reports for court and the parole board. Funnily enough, although the funding was ring-fenced, it wasn't increased, as at the time most of the local authorities redeployed social workers from their own workforce on an 80-20 basis. This meant that Justice Social Work did 80% offender work, as it was called then, and 20% other work, which usually was office duty. Over the years, the life of a Justice Social Worker has increased dramatically from those days. But, as has been touched on already, have the resources also increased dramatically? I would think not. Remembering politically the world of crime, punishment and justice is a huge vote winner if the political party gets the right rhetoric, which is usually about taking a tough stance, looking at punitive measures, and even sometimes introducing and evoking fear into the public. We've seen slogans such as taking back our streets, tough on crime and the causes of crime. We've seen people in unpaid work made to wear high-vis jackets with community service by offender written in the back of them. This is the backdrop that Justice Social Work has been operating in for over 30 years, and it has changed very slightly, I would think, in a lot of ways. There have been numerous pieces of legislation, guidance and group work developments since the 1990s. We've seen the introduction of drug treatment and testing orders, restriction of liberty orders, supervised release orders, supervised attendance orders, which were for non-payment of fines at the time, all brought to us by the Criminal Procedure Scotland Act 1995. We moved into specialist group work with accredited programmes for sex offending, CSOGP, which became MFMC, which is about to come MF2C, and the Caledonian system for domestic abuse. The life of a Justice Social Worker became more dominated by risk assessment and risk management, targeting according to social need and the level of risk posed by an individual to the community. We've seen the introduction of MAPA and the management of registered sex offenders. The use of Visor by Justice Social Work, which I will say no more about because those in the call that know, and I'll leave it at that. Then we hit 2010, 2011, where there was a whole basket of changes, and as Beth talked about, the Scottish Government embarked on reducing reoffending programme, which was to build a credible and effective system of community justice by introducing a new tough and efficient system of community penalties as an alternative to short-term prison sentences, change the way that justice system assess risk, strengthen the links between rehabilitation programmes in prison and the community setting, use diversion programmes effectively to keep people, including young people, out of the system. Now, why does this all sound very familiar? And then we introduced CPOs, which started looking at high-intensity interventions. The need to protect the public being the primary driver, underpinning sentence management, risk assessment and rehabilitation. Scottish Government accept that behaviour change will be the most successful where support is also given to strengthen lifestyle stability and confidence. Why am I telling you all this? Because, one, nothing changes. We've been attempting community sentences and less short-term prison sentences for well over 10 years. And like déjà vu, here we are back again. Each of the changes has resulted in change within justice social work. As each of the changes come in, the social worker has had to adapt and learn new assessments, interventions and ways of working. We've got bail supervision assessments, we've got home detention curfew assessments, to name but a few. The bonus of all this is that what we now have is a group of very highly skilled and trained individuals who are well able to assess and manage the risk and needs of most of the individuals who commit crime. This is despite no increase in resources, or no massive increase in resources. It's been very, very few. A court report has become a complex piece of work prepared with very strict timescales with no or limited room for extension. It requires to be factual with key information about the individual, including the social worker's professional judgment on the risk of harm and advice and interventions and how these might reduce reoffending. A justice social worker's caseload typically includes writing about 4 or 5 of these a week, although that can increase if the numbers going through court increase, and I have known at times that it can reach 8, 9, even 10 have been written by one worker. Community payback orders, parole, non-parole orders are all part of a justice social worker's caseload and can exceed 50 in number. In the main, reports and orders within justice have increased year on year, but the staffing levels have not increased. Alongside this, so workers are required to manage more, with greater demands from courts and parole boards, and also from their own management, as the world has become more outcome focused and evidence based, which you could argue rightly so. There has been an increase in sex offending of all types, and domestic abuse has never seen any significant reduction in many years. We see a rise in more complex cases with individuals struggling with addiction and mental health. We've seen a rise in poverty and people struggling to live on their own income, many on low wages, and a lot of this is just since COVID, or has increased since COVID. A justice social worker now talks about having to help service users with some basic needs. We have people attending unpaid work with holes in their shoes and not having eaten for days. They have no lunch with them. We need to provide dry socks, a warm drink, and even on occasions we've had to provide people with warm winter coats. Most justice offices now operate their own food and clothing banks. And how can we address offending behaviour if someone has not eaten and is hungry? Basic assistance in terms of help with fuel payments have all increased, again especially since COVID. Justice social work has seen a rise in people suffering in a range of mental health issues, having more complex neurodivergent issues which remain undiagnosed. I remember attending an input not that long ago about fetal alcohol syndrome and was able to recognise the behaviours of several service users that I knew. If they had been diagnosed themselves, maybe it could have helped them understand their self better. In many cases, justice social work have had to work around difficulties with no medical diagnosis or intervention, which means constantly asking the question, are we doing the right thing here? Justice social work is a time-limited intervention which is only in place for the duration of a court order or a through care licence. This means that workers will have a small window to effect change, which also includes the very important part of relationship building, which we know is essential for any social work involvement. Therefore, justice social work need to work in partnership with other agencies, especially in very complex cases. What I mean by that is that when justice social work become involved due to court orders, for instance, and there are mental health or adult services involved in some cases, that these services must remain working alongside justice social work. Many times the other agency close the case or take a back seat for the best of intentions, leaving the justice social worker to manage an area that is not always where they have the expertise. What do we do with an individual who is committing offences involving public order, has numerous orders including ASBOs, and is assessed as not being mentally ill, but is assessed as being a high risk of harm to themselves and others in the community? This is becoming more frequent in the world of justice social work. Adult support and protection versus vulnerable adults, where one has a clear legislative pathway and the other not so much. How do we ensure that we work together, collaborating in a multi-agency way, offering support and meeting the needs of the person? This is the struggles a justice social worker has to navigate while remaining accountable to the court and the parole board. What I'm saying is, if we are to be more effective, we must all work together in a family or person-centred way with relationship-based practice. There are many examples where justice social work have worked alongside peer recovery workers, alongside the third sector organisations, alongside adult and child social workers very effectively. With the organisation with the best relationship taking the lead role. Justice social work, we must move away from siloed thinking. Justice social work fell into this way of working at one point at the start of their development, but are now emerging from the other side. It has found a voice on a national stage and will hopefully help as more pressure is put in community sentencing and reducing the prison population. There's an elephant in the room. Why are we looking at early release? Why are we not looking at sentencing? Imprisonment for only those who pose a risk to the public. Why are sentencers not first and foremost as part of this whole prison crisis? Why do we find prisons getting funding which is much more than community justice areas, including justice social work, mental health, recovery organisations, and even defence solicitors? I'll get a cheer for them for mentioning them. Scottish Government would do well to listen to frontline justice social workers who already deliver strong risk assessments, robust community interventions. I may be biased, but I think not, as I see daily the skill of social work staff. I'll finish by saying that social work continues to be a profession that is becoming more marginalised. The pressures in all areas of social work practice continue to be felt as we reduce in numbers. It doesn't matter if you're adult, child or just the social work. The amount of statutory work you require to undertake is increasing and will go on doing so as more people experience poverty. We must work together for the best interests of the community because, as you all know, when it goes right and someone succeeds, there is no better feeling, and that's why we do it all. Thanks.
Brilliant. Thanks ever so much, Jackie. That was fantastic. A fantastic overview there from a practitioner point of view of the issues and the political football. Jackie's highlighted that justice has become and how it's become proceduralized and dominated by risk, but how that's also led to a highly skilled workforce who do a very, very good job under very trying circumstances. So I'm going to ask John now to come in because I can see on the chat that there are some comments. John.
Yeah, thanks, Chair. Ms. Webb's come in with a couple of, the first was a comment, and then I think the second one's a question for Beth, but she says that she's just thinking about Beth's comments on parole figures this year that must be directly connected